Rhinoplasty, one of the most popular categories of cosmetic surgery chosen in the United States, is a procedure that can correct deformities and reshape the nose for both medically corrective and aesthetic purposes. It is important to remember that whether the surgery is chosen for cosmetic or medical purposes, the choice of a good surgeon is of utmost importance. Choosing a surgeon who has been well trained in ear, nose, throat and other facial cosmetic procedures will ensure an outcome as close to ideal as possible. At the first visit to the surgeon, the patient can expect that the doctor will make a thorough examination of the nose both internally and externally in order that he may be able to tell the patient what it is realistic to expect from surgical correction. The surgeon will then tell the patient his ideas for a surgical plan, and if the patient and his doctor are able to agree on the details, the surgeon will take photos and discuss with his patient how the internal structures of the nose can be reshaped with success. The surgery begins with incisions usually made internally or in the area of skin between the nostrils, giving the surgeon access to the bone and cartilage structures inside the nose. Then certain sections of bone and/or cartilage may be removed, augmented or reshaped according to the surgeon's design for the correction. The original skin and tissue is then replaced over the newly shaped internal structure and sutured in place. Soft absorbent packing will be placed in the nostrils and a splint will be applied to the outside and taped in place to help hold the shape of the newly redesigned nose as it heals. The face may swell and bruise in the area of the eyes and nose, and cold compresses as well as medication may be required to control post-surgery pain. Absorbable sutures that will not require removal are usually used, but the packing and the splint will require removal within 6 or 7 days post-op. Most of the swelling and bruising will be gone in 2 to 3 weeks, but some amount of residual swelling can last from 1 month to a year, and it may take this long to determine the absolute final outcome of the surgery. The lingering swelling is usually not noticeable to anyone but the patient and the surgeon. The cost of rhinoplasty varies from surgeon to surgeon and according to the extent of the procedure, but usually ranges between $3,000 to $8,000. While at the surgeon's office for the initial consultation, the patient will have an opportunity to discuss fees and payment plans. Insurance normally does not cover cosmetic procedures, but in order to alleviate the necessity of a patient's paying for the surgery all at once in a lump sum, many plastic surgeons now offer payment plans and are willing to work with their patients in order to work out a satisfactory fee.